Hello everyone. आप सभी को बहुत-बहुत शुक्रिया for joining today's session. I am Ankita and we will be discussing today with about some of the myths and facts about COVID-19 and its vaccination. We have two very special guests with us. We have Dr. Asad Afroz Khan, the Chief of Internal Medicine and Infectious Disease from Tawam Hospital, UAE. And we have Dr. Siddiq Anwar. He is the consultant nephrologist at Abu Dhabi Health Services. I sincerely thank you all for taking out time from your busy schedule and joining us live today. I really appreciate it and I welcome you today's discussion.
Thank you.
Thank you.
Yeah. So, without any further ado, I have with me Prajato. Prajato, can you hear us?
Yeah, yeah.
Great.
Can you guys hear me?
Yeah. I have introduced our
Yeah.
guests today, and without any further delay, we'll be starting off with the questions. Would you like to
Okay.
introduce yourself or say something before starting?
Okay. I just want to welcome Mr. Dr. Asad Khan and Dr. Sid. As Dr. Sid, I have known you for a quite long time now. I really appreciate that you guys have taken out your time from your busy schedule and are here with us to listen to our questions and share your insights with us. Thank you a lot.
Yeah. Thank you for both of you for organizing this session. Hopefully, with Dr. Khan's input, we can address some of the myths which are going around in India. Thank you.
Right. So we have divided the session into three main segments. First is the eligibility of the vaccination, then is the comparison between the different vaccines that we have today, and then we have the post-vaccination and the post-COVID symptoms and how to fight with them. So we'll start with the first one, that is eligibility for vaccination. We all know that the vaccine is very important and everyone should get the vaccination. But to be precise, who should be the one who should be vaccinated and who should not be vaccinated?
Let me start at the second question first. There is no one who should not be vaccinated. Going by that. Now, who should be vaccinated? It depends on the supply. Obviously, the first group should be the high risk. So the high risk could be the frontliners. They can be elderlies. They can be people with chronic illness. So these are the first. These are the ones who should be vaccinated first in line. If the supply is limited.
Right.
And this is how they rolled it out in many countries. Actually, they started from 90 plus, then 85 plus, then 80 plus, the frontliners. And the frontliners could be many, by the way. It won't only be the doctors and the healthcare workers. Sometimes the police guy is also a frontline worker. Your guys who's working in like a garbage picker, he could be the frontliner. Whoever is working in the frontline can be a frontliner and could be a pretty high risk.
Right. Okay, talking about patients who are on chronic medications, like for transplant or cancer medications, can they take the vaccine?
There is no contraindication per se. The only issue is, are they going to mount a good immune response? And there are high risk people, they should be vaccinated. And generally, the only problem is people who are on immunosuppressive medications, their immune response is not so great. So even in US, where they have, even with the Pfizer vaccine, the CDC has recommended them to maintain with the masks and they to take the precaution even after the vaccination.
Right.
But definitely not a contraindication. So, by the way, my mother, she has got a liver transplant, and perhaps she is the first one in UAE who got the vaccine. Because the moment they took her off the list, the first thing I did, the very first day I took her there and got the vaccine. And my dad is on a dialysis, and I think he was perhaps the first dialysis guy who got the vaccine.
Wonderful. And how are they doing? They are doing fine. Like they have
Well,
got
nothing. See, it's all a myth. It's they did perfectly all right. If you keep on listening to the news, you get all the side effects.
That's true. Okay. So
So,
one of my friends asked
not
that
from the
being a
vaccinations, I think we get side effects from the myths more, right?
Right, right. Now let me put it one thing. No, you eat pizza, you drink Pepsi, you eat burgers, samosa, jalebis. All those things could have a side effect. But do you ever think about that?
No, really not.
People,
Yeah.
so people smoke. You know that smoking is harmful, but you still smoke.
Yeah, I get it. Yeah.
yeah. So one of my friend asked that being a cancer patient who has multiple kinds of vaccines are due, for example, influenza, pneumonia, what should be the interval among them if at all the patient is eligible for COVID vaccination?
See, assuming that the person would have received some vaccine already, right? Generally, because since it's a new vaccine, no one knows exactly what it is. The interval of 2 weeks is more than enough. But suppose if you have to decide which vaccine should be given first, if the option is there, I would definitely opt for the COVID vaccine at this point in time. I will complete the COVID course before I go with the other vaccines.
Okay.
And this is what we are doing for our patients right now.
Right. Okay, perfect. And another thing, like this thing will be same for people with different allergies or breathing issues like asthma or something.
See the thing. Suppose if asthma is not a contraindication, and if someone who have got an anaphylactic reaction to some agent, then you just use it with caution. It's not a contraindication, but it's with caution and under the supervision of a doctor. That if God forbid if he gets anaphylaxis, then you treat it immediately. But generally, suppose if someone is allergic to, say, strawberry, then it is not that he's going to get allergic to reaction to an apple too. So it's something like this. If they're not allergic to the vaccine component, they should be okay. Like people who are allergic to eggs. So all that you need to make sure that these vaccines which are prepared, they're not going through the egg. Like I don't think that the AstraZeneca, the Covishield, is manufactured through the egg. I'm not sure about Covaxin how it is manufactured, but definitely not the Covishield. And Dr. Anwar, I guess you received the Sinopharm, right?
Yes, we did. Yeah.
Yeah, and Sinopharm again is not prepared in the egg. It goes through the Virocell because initially they put it exclusion for the people who were allergic to egg, but we managed to get it out ultimately because it was not through the egg. So we really lobbied for that to get it out.
Yeah. So Ankita, can I also answer this question as well? A lot of people are allergic to antibiotics, and and what we had, as Dr. Asad advised here, we advise caution and report symptoms if they happen. Usually there are two types of allergy. One is the anaphylactic reaction, which is the more dangerous one, where your tongue swells up, your mouth swells up, and this usually happens within seconds or minutes of administration of any new medication. कोई आपने कोई एंटीबायोटिक खा ली तो अगर आपको एनाफिलैक्टिक रिएक्शन होता है तो that happens immediately within seconds or minutes. Hence, as Dr. Asad recommended, those people who have allergies, we would recommend that they do it in the hospital where there is some supervision and wait for half an hour, 60 minutes. And if you don't have any symptoms, unlikely you'll get an anaphylactic reaction after that. Regarding allergies, like people having allergies to dust mite and those things, this vaccine should not make that worse. Thank you.
Thank you, Sid, for answering that. Okay, now the next question is, like, most of the people in India are now affected with COVID-19, and there have been like different news coming up that you have to give a period of 5 weeks after you are COVID negative, or you have to take the vaccine after 6 months. So what's the exact duration, and is it different for different vaccines that we have?
There you go. Your CDC recommendation, what is the recommendation is that once you are out of quarantine, you can take the vaccine. This is what the recommendation is. So now, depending on if someone got a very severe infection, so most likely the guy would be sick for weeks and months. So generally, koi bhi acute illness, so you don't go for the vaccine at that time because your immunity is low and you are not going to mount a good immune response. And especially if someone has got a serious COVID, they would have an good antibody for the next few months for sure. So there is no rush to go and take a vaccine in that situation. Mild infection, they are out of isolation, they can take the vaccine.
Yeah. And Ankita, if I could also address that question, it may be कि क्योंकि वैक्सीन की शॉर्टेज है तो गवर्नमेंट ने कुछ गवर्नमेंट्स ने क्या किया है थोड़ा राशन करने के लिए those who have had an infection उनको थोड़ा डिले किया हुआ है because those people who are at higher risk of getting an infection, we want to get them immunized first. But हम यहाँ पे हम लोग immediately देते हैं unless, as Dr. Asad said, they have been seriously ill and become very weak that they won't mount a response to the vaccine.
Okay.
But if someone has got a documented COVID at least for the next 2 months, most likely is not going to get the new infection, except if they get a South African variant. They might get it immediately also.
Yeah.
Right.
So what is the current scenario with the kids? Because benchmark of 18 plus has been added. So what about the kids?
You want me to continue in English or should I go in Hindi?
हिंदी में करें, हिंदी में करें.
Anna, I feel comfortable in both. इसलिए कि अगर ऑडियंस ज्यादा चाहिए तो दोनों होना चाहिए. देखिए, Covishield is basically an AstraZeneca vaccine, right? It's an Oxford vaccine. और जो ट्रायल्स हुआ है दैट इज इन 18+. So अगर आप 18 के नीचे देना है तो ideally there should be a small trial for AstraZeneca. So there is no trial for it below 18. Will it be safe? Most likely it should be, but there is no trial. So that is why 18+ आया है. Covaxin जो इंडिया का जो बना हुआ वैक्सीन है, they have started looking for 12 years and above, so they are going with 12 and above. If you talk about Pfizer, it's already approved for 12 and above. They are already doing a trial of 18 months and 18 months to 12 months. So if that would be fine, that will be approved. In the same tone, I will continue with the pregnancy also. With the pregnancy में जो है, Pfizer have been trialed big time. Big numbers of pregnant ladies were given in the trial, so they find it to be not to be harmful. So basically Pfizer and Moderna vaccine both are approved in pregnancy. In UK they used the AstraZeneca vaccine initially in pregnancy, but they have basically switched over to Pfizer and Moderna now, because Moderna and Pfizer has got a very robust data. देखो West में without data they won't follow. They will die, but they won't follow till they don't get the data. It's a very different type of mindset over there. They've got a very robust data for Pfizer and Moderna, so this is what they're going with. AstraZeneca should be safe, but you need a small trial. But AstraZeneca का थोड़ा UK से data है कि pregnancy में there have been no harm, and this is what they have reported from UK. But they didn't use in kids, by the way, because UK में obviously जब AstraZeneca launch हुआ था, so there was a critical shortage of vaccine, so they started with elderlies.
Okay.
Okay, one more thing. What if I got the first shot of the vaccine and then I got the infection? Right? After that, I'm COVID positive.
Again, the same thing would go. How bad is was the disease? If this is a mild to moderate, once you're out 2 to 4 weeks, go and take the second shot. Suppose you have taken Covishield, the window period is up to 12 weeks. You can, and actually, by the way, it is not only the government, but that even the data shows that you mount a very good immune response if the vaccine is delayed 8 to 12 weeks. So even if the appointment was given you for 6 weeks, you can delay it right up to 12 weeks, because you're still in the window period and you're going to mount a good immune response. I'm not sure about Covaxin, what time period they're using. Are they going from 3 to 6 weeks, or how they're going with the Covaxin? But I assume Covaxin is very similar to Sinopharm, so the period would be the same more or less.
Thank you so much. Okay, there was a message that went viral on WhatsApp. Even I received it, that while you are undergoing menstruation, for girls, you should not take the vaccine. Like, is there any relation with it?
Nothing. Nothing.
So for all the girls who are following that message and keeping them aside from getting vaccinated, so you got the answer, right?
Listen, a very interesting thing. A lot of people initially have got the vaccine hesitancy, and still people have got vaccine hesitancy. So I won't say that it is only for India, all over the world. If you go to America, there's a huge group of anti-vaccinators, huge group, and they are very well educated, they're very eloquent, but they are very, very rigid that they don't want the vaccine. And you had seen with the mask and the anti-mask group a few months back. So that is true all around the world. So we are getting a lot of people coming to our clinic to give a medical report for exemption. And one of the common thing was young ladies coming in that I'm planning to become pregnant. So I would reply them only in 2 lines that yes, I'll give you a medical report, but I would state I've recommended to delay the pregnancy and go ahead with the vaccine. So do you want a medical report? So generally most of them, they'll say thank you and they'll go away.
Okay.
Actually, there's one more funny thing, myth that is going on. Means those who are taking the vaccines or those who are facing COVID, they are thinking that they are some kind of becoming an infertile and impotent. Is that correct?
I don't see. I don't think so. By the way, because see, the thing is, the same story goes off in some areas of Pakistan. That is, they take the polio vaccine, they will become sterile. So it's all. So if someone tells you the same story about polio over here, you will laugh it off, right? The same with it.
Yeah.
I don't think so.
Okay.
And actually, this story was going in UAE also, and the same story was going on with the Pfizer also, that it is going to make people sterile. But I don't think it is. I don't think there is any onus of truth into that.
Right.
Yeah, I think that's a great information for everyone, I guess.
Right.
You were scared, I think.
Yeah. Actually, a lot of young doctors in our hospital, they were delaying the vaccination till a lot of very interesting regulations came into place. That if you do get sick and you haven't taken the vaccine, it can't come out of a sick leave. It goes from your annual. And if you're not vaccinated, every week you get yourself tested, and you have to pay for the test. And if you're vaccinated, you do it every 2 weeks, and everything is covered. But if you're not vaccinated, everything is on you, from the sickness to the testing.
Yeah.
And from the quarantine, whatever happened, you are responsible.
Asad bhai, there's some concern about at least कि there's a thrombosis in young men after vaccination, AstraZeneca. इस पे कुछ आप बोल सकते हैं कि क्या हो रहा है? What is the vaccination thrombosis risk, and who is at risk?
See, this is a very interesting question. Generally, I never bring this issue up, especially when I'm talking with my family members, with my friends in India. See, the risk is 4 in a million. 4 people, 1 million people who are vaccinated. I won't say a million people. 1 million doses given, 4 cases of thromboembolism. So yes, but it's a very, very remote idiosyncratic, a remote chance of getting a thromboembolic episode. But you're talking about risk versus benefit. So the benefit far, far outweighs those risks. But there is a risk when you go out on the street. When you're driving car, there is a risk. So the risk is always there.
Yeah. So
and especially
people can put that in context.
Right.
Put in context. What are the risks? Other common things which cause clots? So compare करें तो you have some kind of statistics. People can risk benefit, raise those, make those decisions.
I think the risk of a stroke would be 1 to 2 in every million anyway.
Yeah.
So I know other people.
But point मैं बोल रहा था कि ना if you have a long distance travel, you're a higher risk of developing clot. If you're taking a birth control pill, you're a higher risk of developing clot. So people don't stop doing those things just because उनको clot का risk है. ये vaccine it can cause idiosyncratic reaction, which is like unpredicted reactions. Very small number of people, that is 1 or 2 in a million. But we have to recommend that everyone gets it.
I'll tell you a very interesting thing about the history of Covishield, because that's a very, very interesting thing. Covishield has been developed by Oxford, right? By Oxford University. And when they were giving it the patency to the company, there was an understanding whom to give. They didn't give it to Pfizer. They didn't want to go give it to any American company, because they know the American companies, they'll go more commercial, and America won't allow the vaccines to go out of the country till their country is covered. And that was not only the thing. They said that for the first year, you have to produce it at a very minimum profit or no profit for poor countries. So what you are getting over here for £2 or $3, when you look at Pfizer, it is $20 to $30 a shot. So in reality, it's a wonderful vaccine and a very good gesture from Oxford. And it's a bloody robust vaccine, because it can, you just have to put it in a fridge. So the rest of the vaccine, like Pfizer and Moderna, those are basically for developed countries or for the Western world, where you manage to arrange the cold chain. Because the Oxford vaccine, the Pfizer vaccine has to be stored at -40. So having freezers of -40 is not going to be too easy in many parts of the world. So suppose you bring it to India, might be few big cities could have it and few good private hospitals, but it is not going to reach even mid-level cities.
Yeah. Okay, so moving on to the next section. The last question from this would be talking about the breastfeeding moms, right? If they are tested positive, should they continue, or the baby should be kept away from the mother?
That's a little bit of a tricky thing. I would prefer them to stay away, because generally by the time they're diagnosed for the breastfeeding mother, most likely the baby is already exposed and they're infected. But it is better to keep them away. Okay. I don't think there's a very clear answer onto that part.
Right. Okay. So it's safe that we keep the babies away.
Yeah.
Okay, moving on to the next section, that is comparison between the various vaccines. So Prajata, would you like to carry ahead?
Yeah, sure. So in India, first of all, so we have 2 of vaccines, Covaxin and Covishield going on right now. And currently we have a Russian vaccine called Sputnik 5. So can you just give a brief differences between these vaccines, and is there anything like people should choose this vaccine and not this one? Is
See,
there any
a
kind of
lot of
categorization?
see, a lot of time it would become more of a personal choice, right? So you've got 3 vaccines which are available, and Dr. Anwar, we were involved with Sputnik trial over here. Ahmad Hamadi was the principal investigator, and I was his co-investigator. So it's a pretty good vaccine, by the way, Sputnik vaccine. It is very similar to AstraZeneca vaccine, Covishield. In Covishield, they use the chimpanzee adenovirus, and in Russia, they use the human adenovirus. So very similar technology. So it's a technological difference, by the way. Covaxin is an old-fashioned inactivated virus vaccine, and adenovirus and Covishield and Sputnik, that are both adenovirus-based DNA vaccines, where the RNA of the virus is incorporated into the DNA of the adenovirus. So it's a completely new technology. So both of them, they're good, depend on what is available for you. But obviously, I should not wait for one vaccine over the other. Both of them sounds to be safe. One thing is for sure, this is a newer technology, and the reason why they evolved this technology, because the issue with the coronavirus vaccine was with the previous outbreaks, like with the MERS COVID and the SARS one, that generally the inactivated vaccine were found not to last for too long. That when you give the vaccine, generally the antibody titers or the protection would dwindle earlier. So that was the reason to go with these new technologies. But whatever you get, that should be good enough. It's more of a personal choice, I would say. Obviously, the data with the most data that you have is for the Covishield. The Sputnik data is still seems to be 90% effective, but the most robust data or the real life data is with adenovirus, with the Covishield.
Right.
Okay,
Talking
so
about the optimum time gap
yeah.
between the 2 doses of the vaccines, right? For Covishield and for Covaxin, what is the optimum time gap that one should try to keep? Although
Covishield should be 8 to 12 weeks, between 8 to 12 weeks. And Covaxin, I think it should be 3 to 6 weeks, something like that. I'm not sure what they're doing for the Covaxin. Like what we do for Sinopharm over here is 3 to 6 weeks. So I think it is very similar. So it should be something like that.
Okay, and talking about Sputnik?
Sputnik would be the same as a Covishield, 6 to 12 weeks.
Right.
What we used in the trial over here was 3 to 4 weeks.
Okay. And talking about the amount of protection that I get if I take just one shot of each vaccine, suppose. So what is the differences?
Again, that Covishield data that just came out from UK 3 or 4 days before, what they say that with one shot the protection is around 50%, and it's almost similar to the Pfizer. They say it could go right up to 80 to 90%, but the risk of hospitalization stays around 50 to 60%. I don't think that Covaxin would be offering too much protection after the first shot, so you need at least 2. But even with Covishield, if you just go with one shot, I don't think you're going to have too much of a lasting protection. So the only one vaccine that has been approved for single shot is Johnson & Johnson.
Yeah. So, but like we are now hearing that regarding this COVID, there's so many strains coming up, right? And
Yeah.
are these vaccines quite powerful to protect us from each and every one of these strains?
For some it will protect very nicely, for some it would protect partially, and as I told you, for the South African strain, which we don't have in India and in many parts of the world, the protection would not be so great. And obviously you don't think that this is going to be the first and the last shot of vaccine. This is going to be an yearly affair, and the next year when you come out with a vaccine, obviously the vaccine would be played around to cover the new strains, what they do for the influenza. So every year the vaccine is altered a little bit to cover to the possible strains that would become in that particular year. So that is what would happen with the COVID vaccines also, that they will alter a little bit every year.
Okay, so you're saying this would be more like an annual thing.
This is going to be at least 5 years. For the next 5 years, it's not going anywhere. And the moment you say it is gone, it will come back again.
That is happening. That is happening. They are already realizing.
Right?
Yeah, we are quite seeing it right now. Means at the end of 2020, I was just thinking that this is just 1 year, and from next year
Listen,
everything will be.
in November, December, COVID was very, very low in India. One of my friend from Hyderabad is a cardiologist. He was in Hyderabad. And he said, I swear that there is no corona over there. I've gone to the hospital. I spoke with the hospital CMOs. I went to the graveyard. I went to the crematorium. I checked everywhere. No extra deaths. And then they have a big marriage party of 800 people. So I told him that, listen, I hope that I am wrong. And I just pray that I am wrong. But my feeling it is going to come back, and it will come back big in India, because this was what it happened in the first wave also. It started from UK, reached Middle East, reached Kerala, and all of a sudden it reached all over India. And this time people were completely unprepared. Whether it is a central government, a state government, or the people, everyone was unprepared.
Yeah. We have got a
Yeah.
bunch of questions in the comments. So Afroz Samad is asking, some studies are pointing towards a better immune response when 2 shots of different vaccines are given compared to the same vaccine. So what's your take on this?
Listen, I don't think so. This is what they're doing in a study. They're using Sputnik and Covishield together, by the way. So that's a promising trial that is going on, and we are also going to do the trial. Obviously, we call it the AstraZeneca vaccine over here, but it's exactly the same. Covishield is the same. They tried combining AstraZeneca and Pfizer in UK, and again that has more to do with the shortage of vaccine and the speed with which they want to deliver. Immunity wise, that was not much of a difference, but there was a little bit more side effects, but not serious side effect, more of a minor side effects.
Okay, we have another question from Gautam. He is asking, is there a connection between corona and black fungus?
That's a very interesting thing. Black fungus has got multiple issues, right? What is happening in India right now? So that's a mucormycosis. What they mean, see, black fungus, we also mean aspergillus, by the way. Aspergillus is black, but I assume when they're talking about the white fungus, they mean the aspergillus. I tried to Google and search it, what they really mean by white fungus. So it's mainly in the news media. I don't find into any medical literature, nowhere. No one even mentioning about the genus of it, but some places I see it is mentioned as aspergillus. But by the way, you know, every one of you would have seen aspergillus. If you have seen the black spots in your washroom or your kitchen, that is aspergillus. So aspergillus and this black fungus, which is mucormycosis, mucorales, is a very, very common fungus all around the world, especially in warm, humid area. So generally, immunocompetent people, they don't get it. So someone, when they're getting corona, their immune system is going to go down. But that is not the only problem. But I think it is multifactorial. There is a very heavy usage of steroid in India, completely uncontrolled, high dose, long duration, broad spectrum antibiotics, poor control of sugar. And I think one of the other big concerns that is being raised is about the delivery of oxygen, how the oxygen is being delivered. So a lot of time the industrial grade oxygen is being delivered, and it is not delivered in the cleanest of fashion. So basically we have got an outbreak of a black fungus. Nowhere in the world we have got so much of mucormycosis. People have died with corona a lot, but not so many people have got mucormycosis, because it's a very serious matter. The mortality of black fungus, especially when it is a rhinocerebral, when it involves the sinuses and the brain, the mortality could be as high as 60 to 80%. And the treatment is extremely expensive. You know how much Ambisome costs for a day? It's 15,000 dirhams, 15,000 rupees a day. Then you need a major surgery. Then there are side effects related to the medicine. So you're talking about some very, very serious matter, more serious than COVID actually at times.
I mean, what I can say to that is you have to understand the hospital capacity was increased in many places 200, 300 times to cope with the huge surge of patients, And a lot of these infections, hospital-acquired infections, because the nurses are not able to care for the volume of patients they're seeing. It is not a defense. It's just the systems are built in hospital to prevent hospital-acquired infections, cleaning of the mask, keeping things sterilized. But you may have seen family members being cared for in artificial wards, in tents, in new wards which have been readily built. So normally जब hospital के wards बनते हैं, उनमें एक health and safety का inspection होता है, and a lot of mitigating factor systems have been put in place. Raat hospitals khulne pade, wards banne bane, and there's not enough doctor nursing ratio available. So that probably is also contributing to some of these hospital acquired infections. But as Dr. Asad says, the immune system, this virus not just affects people directly, but also it seems to trigger a dysregulated immune response. And this is the dysregulated immune response is what is causing a lot of its complications. And maybe the infection is, these fungal infections, part of that.
Hello?
I think we lost Dr. Asad for a moment.
Might be some kind of network issue.
Okay. So maybe I can answer the next question, Ankita, while Dr. Asad is joining back.
Yeah, sure. So, Rajat, you can go ahead with the question.
Yeah. So first of all, the very common question there is this: after the vaccination, what are the common side effects of these vaccines, Covishield or Covaxin or Sputnik maybe?
So basically, what we are doing, if you remember your high school lesson about Edward Jenner, you're creating a small infection, a minor infection, to try and make your immune system recognize this is a foreign body. Either it's a small fragment of the virus, like in the mRNA vaccines, or you implement the genetic material of coronavirus in the adenovirus vaccines, which is Covishield or the Sputnik virus, where you take a benign virus, put in the genetic material of the virus, and make your immune system respond to it. एक बार आपने immune system respond करता है, next time you get exposed to that virus, your immune system has developed memory and it starts attacking it. So when you create a minor infection, you will have some fever, you may have headache, you may have muscle pains. So these are expected side effects of minor vaccination. So Dr. Asad, the question was, what are the side effects of a vaccination? So I was addressing that.
Right. I listened to you. So you already covered it. Generally, most of the time they are minor. Nothing very serious. Some people can get a mild allergic reaction, and people who do get an allergic reaction, so those are the ones who should not go for the second dose. If they do get a skin rash and thing, then even if they have to go whenever they go for a vaccine, it should be with a different type. Suppose if you get it with a Covaxin, a skin rash or thing, bad one, then you go with a Covishield and vice versa.
Okay.
But generally जो है vaccine safe है. Minor side effects है, 2-3 दिन जो है body ache, muscle aches वगैरह हो सकता है, and then generally it settles down.
Yeah. Okay. We have a question.
But suppose किसी को ज़्यादा serious headache हो रहा है, weakness हो रहा है, then they should go and address it to the doctor.
Right. Yeah. Absolutely.
Samjha.
Okay. So we have a question. It says that recently we are hearing a lot of cases of cardiac arrest for post-COVID patients. Why is that a case, or is it related to COVID-19, or is it?
देखिए दो फैक्टर है उसमें. एक तो वायरस खुद भी मायोकार्डाइटिस करता है. इट्स पूरे बॉडी के हर पार्ट को इफेक्ट करता है, फ्रॉम ब्रेन टू द लंग्स टू द हार्ट टू द किडनीज. इट कैन इफेक्ट एवरीवेयर एक्चुअली, एंड हार्ट में ये मायोकार्डाइटिस भी करता है. एक तो वजह वो है कि जिसकी वजह से कार्डियक अरेस्ट भी हो सकता है, और दूसरी चीज है कि ये थ्रोम्बोसिस करता है, जो आपने सुना होगा कि लॉट ऑफ पीपल जो आते हैं उनको इंट्राक्रेनियल ब्लीड हो गया, हेमरेज हो गया, स्ट्रोक हो गया, और साथ साथ उसी तरह से उनको जो है एक्यूट एमआई या हार्ट अटैक भी हो सकता है. सो दो पैथोफिजियोलॉजी है. एक तो एरिथमियास की है कि अगर मायोकार्डाइटिस वगैरह हुआ है, और दूसरा जो है कोरोनरी थ्रोम्बोसिस का जो हार्ट अटैक होता है, उसकी वजह से भी सडन कार्डियक अरेस्ट हो सकता है.
और एक बात है कि ना जो पीपल हु बिकम रियली इल are the people who are diabetic, hypertensive, elderly, who are at risk of developing these problems, heart attacks, strokes anyway. So people who have COVID, आपने देखा होगा उनकी heart rate 120, 130 होती रहती है. They're struggling to breathe. They're in ICUs, and these people are undergoing a huge amount of physiological stress. For example, if I ask Ankita, when will your heart rate go up to 130, you'll say, I have to run 1 kilometer. लेकिन ये elderly people उनके heart rate 130 है 10 days 20 days, so they are undergoing a lot of physiological stress which puts them at risk of developing these diseases.
वो तो इन हॉस्पिटल में ही वो प्रॉब्लम हो जाता है उस तरह का जो है. लॉट ऑफ देम दे गेट इनटू कॉम्प्लिकेशन जो एज, ब्लड प्रेशर, डायबिटीज और ओबेसिटीज, ऑल ऑफ देम आर इंडिपेंडेंट रिस्क फैक्टर्स फॉर मोर्टेलिटी, जिसका आउटकम्स गड़बड़ाता है लोगों का. और यंग लोगों में द नंबर 1 जो रिस्क है दैट इज ओबेसिटी फॉर अ पुअर आउटकम.
अतुल जी पूछ रहे हैं कि उन्होंने कोविशील्ड लिया है इंडिया में एंड नाउ व्हेन ही गोज बैक टू यूएस कैन ही टेक मॉडर्ना और फाइजर?
उनको यूएस में कोई दूसरा ऑप्शन भी नहीं होगा. द ओनली थिंग दैट इज अवेलेबल इज मॉडर्ना, फाइजर और जॉनसन एंड जॉनसन, एंड आई डोंट थिंक देयर वुड बी एनी इश्यूज. Because they already tried this thing in UK. They were trying to combine AstraZeneca and Pfizer. So I think he should go with the Pfizer. Yeah.
And Spain में भी उनकी गवर्नमेंट ने बताया कि they had AstraZeneca the first round, अब सबको Pfizer दे रहे हैं वो लोग. So that is possible, no problem.
Yeah.
Okay. मधुरिमा जी पूछ रहे हैं कि what are the general precautions जो कि हमें लेना चाहिए कोविड की रिकवरी के बाद regarding diet or lifestyle whatever?
देखिए, पहली तो चीज है कि लाइफ स्टाइल मॉडिफिकेशन इज अ मस्ट. कि आप जैसे जो भी लिमिटेड आपका सिचुएशन हो, क्वारंटाइन भी हो, डू एक्सरसाइज, डू इंसेंटिव स्पायरोमेट्री.
I think we'll lose Dr. Asad again.
Connection issue.
So I mean, basically, if I could take over the answer, lifestyle measures important for any healthy living. ये तो important है. Respiratory precautions needs to be taken. जो भी this is a respiratory virus, तो mask पहनना, keeping safe distance as long as it's possible is very important. Hand hygiene measures and all those are important anyway, general life में. But इस virus के ना respiratory it doesn't have to be an N95 mask. It could be just a regular mask. People who can't afford a mask, just covering the face will be important. Some people are using visors. I think that's a good idea because when you're coughing, when you're sneezing or even speaking, you can have an aerosol, thin water droplets. They can cause the infection to spread. So I think those things are important. Obviously, diabetes, hypertension, ka check karana chahiye. What happens is when a lot of these patients, when they get hospitalized, new medical problems have been found out for them. Diabetes has been picked up, hypertension has been picked up, mild kidney disease has been picked up. We would recommend that once they're better, they should probably go for a follow-up. People who have had severe COVID, they probably will have a problem. उनकी जो lung capacity may reduced. We don't know yet, but looking at these CT scans of some of these people, especially who are smokers, they may need a long-term respiratory follow-up. So what we would recommend is after a few weeks, they go and see either the general practitioner or if they can afford a pulmonologist, the lung specialist होते हैं, so that they can do a follow-up appointment to see if their lung capacity is back to normal or they need some medications going forward. So those are the things I would recommend.
Okay, thank you. We have Zainab's question. She is asking कि cytokine storm क्या होता है? Why is it affecting and killing COVID patients? I heard it is some kind of a respiratory illness.
So I'll let Dr. Asad come. He's come back. He can answer this COVID storm. I think you're mute, Dr. Asad. आप mute है.
तो cytokine storm जो this is part of the disease spectrum. It's more, I won't say it's a different disease. It is part of the disease spectrum. तो cytokine storms में जो है, cytokines are the inflammatory protein material. समझिए आप है जो release होता है in response to the viral infection. So cytokine storm जो बराबर जो reflect होता है sudden deterioration in the respiratory function, high grade fever और कुछ लैब पैरामीटर्स है जो ऊपर चला जाते हैं. तो उसके ट्रीटमेंट के लिए जो है जब स्टेरॉइड यूज हो रहा था दैट मॉडिफाई द साइटोकाइन स्टॉर्म, और उसके लिए कुछ दवाएं हैं जो यूज होती हैं cytokine storms के लिए. But when you use, all those are immunomodulating medications. So whenever we use those medicine, that should be under the supervision of doctors and the people who know what they are doing actually.
तो ये
But
जो
generally,
सॉरी
yeah, go ahead.
So ये जो cytokine storm का जो मेन वरी होती है जब you will find that 10 days or 14 days after the illness suddenly patient deteriorates, उनका जो oxygen requirement suddenly drop होता है. इसमें क्या हो रहा है कि ना normally our lung epithelium जो airway का है ना, it has a very thin lining where gas exchange takes place. Oxygen जहाँ अंदर जाता है, carbon dioxide बाहर जाता है. And it's a very a thin lining which is separating the lung, the outside air, to the blood compartment. जब ये cytokine storm होता है तो your body immune system जो white cells हैं, they are releasing hormones, sorry, not hormones, mediators, inflammatory mediators, to recruit more cells to come. You know, it's like, for example, you see, a soldier sees an enemy, in this case a virus. Not only it will attack the virus, it will say, I need more help. It will recruit other white cells to come. So unfortunately, क्या होता है इसमें more and more white cell comes, crossfire होती है, and you have collateral damage. And the collateral damage in this case is lung जो हमें normal healthy lung है, tissue है, वो destroy हो जाता है. Then what happens is, because of cytokine storm, मैं बता रहा था जो normal जो barrier है between your outside air and the blood compartment is broken down, and lot of fluid starts going into the lung, into the place where the gas exchange takes place. So you will find that suddenly the oxygen requirements go जाते हैं. They're on high flow oxygen. They're on a special breathing mask called CPAP or BiPAP. Sometimes these patients also end up on ventilators. So this scenario, as Dr. Asad was mentioning, there are some medications which are used, but it has to be done under supervision.
Okay. I have a question from my side actually. So I was just thinking कि suppose मेरा COVID हुआ है, okay, and after the post-recovery COVID situation, I have antibodies in my body, right? So if I take the vaccine, will it be more powerful, like the antibodies and the vaccine together? Will it be give us more protection or something kind of that?
देखिए वैक्सीन जो है that gives you a more durable protection longer term. और जो खुद इन्फेक्शन होता है, स्पेशली विद कोरोना वायरस, आई एम नॉट टॉकिंग अबाउट ऑल इन्फेक्शंस, सम इन्फेक्शन जैसे हेपेटाइटिस बी से अगर होता है तो दैट गिव यू इम्यूनिटी फॉर ऑलमोस्ट फॉर द लाइफ, ये हेपेटाइटिस ए से, बट दैट इज नॉट ट्रू विद द कोरोना वायरस. तो कोरोना वायरस के इन्फेक्शन जो है फ्यू मंथ्स लास्ट करता है एंड यू कैन अगेन गेट री इन्फेक्टेड. सो इट्स अ वेरी डिफरेंट टाइप ऑफ अ वायरस. तो एंटीबॉडी गिव यू अ मोर ड्यूरेबल immunity. तो अगर आप vaccine, that is the reason कि even if you get the coronavirus, you should go for the vaccine. And generally there is no point to test, right? Once the vaccine is available, there is no point to test. Just go and take the vaccine.
Yeah. Now I also one thing which just to address one more concern you had is अगर antibodies हैं तो vaccine लेना है नहीं लेना है. We don't have a rough idea कि क्या level of antibodies are protective. What levels of antibodies are neutralizing against the virus? ये हमें information नहीं है. But in patients who are on, say, dialysis, who have medication, who are on medications which suppress the immune system, getting the antibody level is useful, at least for the patient to make a decision. उनको क्या करना है ना? Because they should not be under the impression कि मुझे vaccine मिल गई है, मैं protected हो गया हूँ, or I can start traveling and not adhere to any precautions. So the antibody levels are useful in those patients, and we could maybe consider a booster dose in those group of patients, or trying with a different antibody and vaccine. If they didn't respond to, say, Sputnik, they could try Covishield or Pfizer, and those who don't develop the antibodies. So I think the antibody testing is in small population mein, it is helpful. And maybe after 6 months after the vaccination, if you want to check if you are still protected or if you have reasonable antibody levels, then you can consider doing an antibody level. But not immediately after an infection, or not to make a decision whether you need a vaccine or not. You all need a vaccine. Okay?
Okay. So
Hope I was
suppose I have corona vaccines. I have got a few cases of my friend, and that they did not have any symptom of COVID, right? So suppose someone has COVID but did not have any symptoms, so they really didn't know, and they went to take the vaccine. So will anything happen? Means during
No,
the COVID situation?
no, no. I mean, we would still give the vaccine. The antibody is maybe they will have a robust response to the vaccine. That's good, but we all need the vaccine because, as Dr. Asad was mentioning before he went off, कि in इस virus में vaccine provides better protection than a previous infection, even a subclinical infection.
और ऐसे भी जब मास वैक्सीनेशन होता है, you're talking about the mass vaccination, the whole country, it's practically impossible to check onto the antibody titers. और दूसरा उसका प्रॉब्लम ये है कि when you go and do a commercial antibody titers, there are a lot of antibodies to the coronavirus. अब आपको उसको हम लिस्ट बताएंगे तो आपको ताज्जुब होगा. There is an antibody against nucleocapsid. There is an antibody against the S1 spike. There is a neutralizing antibody. अगर आपको टेस्ट करके देते हैं nucleocapsid antibody, that might come back negative post vaccination because you have to check the S1 spike and the neutralizing antibody. All the labs are not doing the test. So it's not so straightforward that I go and get the test and you get a right answer. So obviously so this is where the research and trial comes into effect, because like suppose the jahan trial ho raha hai, suppose they've got 100,000 patient and they're following the antibodies or whatever, and they keep on following and they know exactly when to give the booster. But by the way, when they did the Pfizer trial, they never checked the antibody titers, by the way, and the likewise with AstraZeneca, they never checked the antibody titers. They just went ahead and they vaccinated. Like the Sinopharm vaccine, what we used in UAE, they were checking the antibody titers. So now all of us, we got attuned to the fact that we have to check the antibody titers. But when you're talking about mass vaccination, I don't think that we should rely on any of those things. We should just go and get vaccinated. Everyone who do get an opportunity, unko vaccine le lena chahiye.
Right. I think we are mostly done with most of the questions, and I think we have got a bunch of audience as well who are constantly listening to us. The last question that I have is like there are so many friends are suggesting take this medicine, you can take this vitamin tablet, this will help you, this will not. So where can we get the authentic information about the medications?
देखिए, इन नटशेल आपको एक बात बताएं, अभी तक कोई भी बहुत बेहतरीन दवा नहीं है जो कहा जाए कि इट वर्क्स परफेक्टली फॉर कोविड. अब मरीज को कुछ दवा चाहिए होती है, तो कुछ दवा तो ऐसी है जिसका हार्म नहीं है, जैसे विटामिन वगैरह रिलेटिवली सेफ है, लेकिन स्टेरॉइड इज नॉट अ सेफ मेडिकेशन. And the only one which has shown to be of proven benefit is the steroid in a subset of patients, not in all patients. जो decision to treat use a steroid is based on a very big trial conducted by WHO in many countries simultaneously, and there were thousands and thousands of patients in there, which is known as a recovery trial. उसमें उन्होंने देखा था कि स्टेरॉइड यूज कब करना है, और जहां पर ऑक्सीजन का रिक्वायरमेंट नहीं है वहां जो स्टेरॉइड यूज हुआ तो आउटकम वाज स्लाइटली वर्स, और जहां पर ऑक्सीजन का रिक्वायरमेंट था वहां बेनिफिट था, और वहां पे थोड़ा क्लियर बेनिफिट था, लेकिन डोजिंग ऑफ स्टेरॉइड वाज फिक्स्ड. That was not any amount of steroid, a fixed amount of steroid and a fixed number of days. और बाकी जो चीजें हैं, it's more about timing कि कब कौन सी दवा यूज करना, and I would leave it on a judgment of a good doctor rather than on a decision of the family and friends. I tell you a very interesting thing. This is in my family what has really happened. One of my families, I am from Patna. So my mausi lives जहाँ पे रहती हैं, तो उनको भी पहले कोरोना हुआ and she got admitted. And few of my other relatives, all of them, they were having fever, and all of them they're educated, by the way. All of them they were COVID deniers कि COVID कुछ नहीं होता है, वैक्सीन वगैरह सब ऐसे ही बात है. और जो जिन लोगों को हुआ वो कह रही कि नहीं, जो ट्रीटमेंट करना वो हमारा बेटा करेगा. And बेटा is a marketing executive. He has got nothing to do with medicine far and wide. So he is going to do the treatment. उनके घर में 4 लोग खत्म हो गए. 4 deaths back to back within a matter of 1 week, 10 days. They have an opportunity to take the vaccine which they denied. including my aunt. She kept on seeing the news and coming out with all type of things. Most of my aunts, they took the vaccine immediately the moment I told, but she was the only one who delayed. She got the COVID, but she pulled through, but she delayed it quite a bit. And I'm pretty much sure if she would have taken the vaccine, देखिए, vaccine does not prevent you from getting corona, by the way. That's very important. You can still get COVID, but the chances of death is markedly low. The chances of a severe illness is very low. So generally the disease would stay mild to moderate. You might end up being in the hospital, but not intubated or not dying. That is a very, very high chance, because even Pfizer vaccine के साथ जो people who have died are very handful. You're talking about few dozens only. Yes, they might end up being into the hospital, but they'll come back once you have taken both the vaccine.
Right. Okay, so
Another word of caution: when you go for the vaccine, don't go in a crowd, because if you're going in a crowd for the vaccine, that is the high risk to pick up the virus at that time.
right. And in India, the situation is really worse. Like wherever vaccines are given, it's unorganized. Nothing has been planned. People are going in groups, and it's all a mess.
मुझे एक बताएं, जब when the thing was very easy, no one was taking the vaccine.
सच बात है.
Well, there was, see, अभी तो अवेलेबिलिटी की बात है कि पूरा 1.4 बिलियन लोग को एक साथ लेना है वैक्सीन. पहले तो इतना आसान था कि आप जाइए और आराम से जाके लेके चले जाइए, and people were not willing to do it.
सही बात है.
But I think you have to be, I think precaution has to be exercised, discretion should be exercised. भीड़ भाड़ उसमें ना जाइए. You will get an opportunity to get the vaccine in a safe environment.
Yeah, we really hope that.
Yeah, you will get the opportunity, but when you get the opportunity, don't think too much.
Yeah.
That is the key. Don't rush, don't panic, but you will get an opportunity.
Yeah.
Yeah. So Apratim is asking that if I have recovered from COVID, why do I have to wait for 3 months to get the next vaccine?
You don't see. No, this is a very important question. देखिए, vaccination जो है, it's a public health measure, and it's a matter of policy. It is not a matter of individuals only, right? Or a basis of individual doctors. बात ये है कि अगर first what you have to do, you have to rationalize the usage of your vaccine. You know कि even if you have got the full supply, you can't vaccinate everyone at the same time. Even if you've got thousands of vaccine centers all around the city, you can't vaccinate the whole city at one time. तो उसमें आपको prioritize करना होगा. Prioritize the elderly first. Prioritize the high risk first. जिसको infection हो गया है, for next 2-3 months they are safe, by the way. Can you take it in 2 weeks? Yes, you can go and take it in 2 weeks, but you don't have to go crazy to go and take it in 2 weeks. Let the people who didn't have the virus or at high risk go and take the vaccine first.
सही बात है.
Yeah, I think it is correct, because in India there's so much population, crowd can never be, escaped. But the people who already have these antibodies in their body, I think they can
wait, but don't wait indefinitely. Wait for a reasonable amount of time, 2 to 3 months, but don't keep on waiting for a year.
Yeah.
Okay, Dr. Sid was telling something about vaccine-induced thrombosis. I would request if you can explain that in simple terms so that the normal audience can understand what is it exactly.
देखिए, थ्रोम्बोसिस में होता है कि क्लॉट, ब्लड क्लॉट समझ रहे हैं, ब्लड क्लॉट हो जाना ब्लड वेसल के अंदर में. अब वो क्लॉट जो है दिमाग के वेसल में भी हो सकता है. अगर ब्रेन के वेसल में क्लॉट होगा तो उससे जो है स्ट्रोक हो जाएगा, और अगर हार्ट के वेसल में क्लॉट होगा तो हार्ट अटैक हो जाएगा. किसी और बड़े वेसल में होगा तो उसका जिस ऑर्गन को सप्लाई कर रहा है वहां होगा. लेकिन जो मोस्ट ड्रेडेड होता है वो दिमाग का होता है. या दिमाग के वेसल में होगा तो स्ट्रोक हो जाता है.
So any tips how to prevent that, or precautions you can take?
It's an idiosyncratic reaction. You can't predict from before. And especially if someone is taking a birth control pill और कोई दूसरा thromboembolic उनको क्लॉट होने का ज्यादा चांस है, स्पेशली बर्थ कंट्रोल पिल पर हो या कोई ऐसी बीमारी हो जिसमें उनको क्लॉट हो रहा हो, जो कि बहुत रेयर बीमारियां हैं ये सब, तो उसमें अवॉइड करना है. कोविशील्ड कैन बी अवॉइडेड, बट दैट इज अगेन आई वुड लेट द डॉक्टर डिसाइड रादर देन एन इंडिविजुअल.
अच्छा, गवर्नमेंट में ये जो चेंज कर रहे हैं वीक्स, कभी 2 डोज के बीच में 6 वीक्स, कभी 8 वीक्स, कभी 10 वीक्स, ये क्या जस्ट भीड़ कमाने के लिए है और इज इट रियली समथिंग?
देखिए, आपको कोविशील्ड का तो मैंने बता दिया कि द डाटा शोज 8 to 12 weeks, very robust response compared to when you give it in 4 weeks. So the more reasonable thing to do is 8 to 12 weeks.
Okay.
So even when they tell you 12 weeks, looking at the shortage of vaccine or everything, I don't think there is anything wrong in it, by the way. वो होता नहीं कि हर चीज को हम लोग थोड़ा सा सेंसेशनलाइज करते हैं एंड वी लव द कॉन्स्पिरेसी थ्योरीज, तो लगता है कि कुछ गड़बड़ हो रहा है, बट आई डोंट थिंक सो. And again, mind it, COVID-19 is a moving target. It's a new disease. And what I'm telling you is what the information we have for now. Might be the information would change next month. You would get new information, newer medications, newer vaccines.
Yeah. So which are the target sites and we should follow authentically कि ये सही information है.
भाई देखिए, या तो आप एम्स का जो गाइडलाइंस वगैरह होता है वो ठीक है, आपने सीडीसी का साइट देख लिया, या जो ऑथेंटिक गवर्नमेंट बॉडीज के साइट है, लुक इनटू दैट, जो हेल्थ रिलेटेड है, नॉट मतलब एनी, जो हेल्थ रिलेटेड गवर्नमेंट साइट्स जो हैं. And there's not actually, I think there are 3 parts to the disease, right? Containment में जो है, जैसे अभी लॉकडाउन हो रहा है या सोशल डिस्टेंसिंग है, वो everyone has to maintain without even looking into a site. Even if you take the vaccine, maintain that. As long as this pandemic is going on there, exercise caution, बड़ी पार्टीज नहीं हो, बड़े गेट टुगेदर्स नहीं हो, ज्यादा crowded स्पेस में नहीं जाए. That is the containment part. उसके बाद से प्रिवेंशन है जो कि वैक्सीनेशन है, और जो थर्ड पार्ट है ट्रीटमेंट है, अर्ली डायग्नोसिस एंड अर्ली ट्रीटमेंट. तो इसमें जो लॉट ऑफ टाइम एज एन इंडिविजुअल जो अवेयरनेस होना ज्यादा जरूरी है. if you are smart, have more common sense, you will do well.
सही बात है. Okay, I think we are done with most of the questions. It's been 1 hour now, so we won't waste any more of your time. Prajato, would you like to end? Would you like to add something?
I think I had my fair share of questions. I think Dr. Azad Khan and Dr. Sid has their own work now to do.
Okay. Yeah. So I think
as I was telling, Dr. Asad had some phone call. So let's not waste any more time, I think. And those who are watching us, I'd request every one of our audience and our subscribers to share this video as much as possible, because I think this is the most important video that will be going on for at least this year.
Yeah.
I think so. Also, one thing which I would request is, as Dr. Asad was saying, personal बात करें. आपके जो घर वाले हैं, जो who are like misled by all this fake news which gets circulated on WhatsApp, उनको address personally, one-to-one. That's pretty important, because sometimes what happens is a lot of these concerns are because of fears inside. And you ask them, क्या fear है आपका इस vaccine के बारे में? How can I address this? And get you the authentic information. That's very important. And engagement है very important है. Sometimes what happens is doctors बोलते हैं, but if their loved ones is recommending, people will do it. People are more likely to do it.
और जो बताए तो वैक्सीन हेजिटेंसी और कॉन्स्पिरेसी और व्हाट्सएप यूनिवर्सिटी सब चीज जो है काफी कंफ्यूज कर देता है.
And public is like कि कहाँ से क्या का input ले. They are watching WhatsApp, they are watching news, they are watching the sites, and they are all confused. So we got real authentic information जो हमें याद रखना चाहिए. And I really wish कि we go through this very soon. It has been a long patience test for every one of us, and we are still at home. We are still lucky, but the doctors
Right.
out there, the emergency workers, they are constantly working day and night, and उनका भी patience का एक limit है. So I really hope we go through this very soon and things are better. Thank you for joining us, Dr. Sid, Dr. Asad, and I hope we go through this very soon. That's the only thing I have to say. Stay safe, do wear your masks, maintain all the precautions we have, and once you get the chance to get vaccinated, do get the vaccines. That's the
and stay positive. It will pass by ultimately.
yeah. Okay. Thank you.
Thank you.
Okay, thank you.
Good night, and do share the video and let your friends and family know the truths and the facts. Thank you.
Thank you very much.
Stay
Thank
safe,
you.
guys.
Thank you. Bye-bye.
Take care. Bye.